Hi, I'm Kim Snyder. I'm a physical therapist specializing in pelvic health. I'm here to walk you through your pre-surgery rehab for your upcoming surgery. When your prostate is removed, there are some physical changes that will occur that can lead to urinary incontinence and sexual dysfunction. If you're well prepared before this surgery and you continue the strengthening exercises after surgery, you can actually ward off some of these ill effects. So if we look at this model, that you're looking at the front of a pelvis. If I open up the model and turn it to the side, you're going to be able to see the insides of your pelvis. So this big muscular organ right here is your bladder. And it comes down into a neck, and there's actually a muscle that surrounds the bladder neck that actually holds the bladder tight whenever urine is filling it. Below the bladder is the prostate, and then below that is your pelvic floor. So this pelvic floor is actually 5 layers of muscle and connective tissue. Those layers of muscle and connective tissue have many functions. So when the prostate is removed, the bladder will actually descend and the pelvic floor muscles can support the bladder and the urethra. If they're strong. If they're weak, there's not going to be much support there. So of course, they help and aid incontinence, which is going to keep you from leaking urine. And it also, these muscles are involved in breathing, in sexual function, and also balance. So when we think about the pelvic floor muscles themselves, in men, they're actually pretty undertrained. And the reason they're undertrained is because the prostate is a big support for the bladder and a big support for the urethra. That's that tube that's draining the bladder. So when I ask a man to contract his pelvic floor or do a Kegel, oftentimes what we see is they're using big muscles like their buttocks or their belly, which actually lets the pelvic floor relax. So they're doing a bunch of Kegels, but they're not doing the exercise that's targeting the right muscle. Sometimes, in fact, when men are doing this contraction, they'll actually hold their breath and bear down. That'll actually open up the pelvic floor and relax it, bulge it almost, which is the exact opposite of what we're trying to achieve. This video will not only help you identify these muscles, where they're located, but it'll also help you learn how to contract the muscles effectively. And then we'll talk about how are we going to get these muscles strong for the job that they're ready to tackle. There are 3 muscles in particular that we want to identify. The first one being the external urethral sphincter. That muscle actually encases or circles around the urethra right below where your prostate was. This muscle is a squeezing muscle. So in order to activate it, I want you to think about pinching off your urine or squeezing back urine flow. That will assist in activating that muscle. The second muscle is your Bulbospongiosus muscle. It sits behind the urethra, wraps around the front of it, and when it's activated, it will actually pull the front of your urethra in. To get that muscle to activate, if you simply think about retracting your penis or shortening the penis, and then also lifting your testicles into your pelvis, those 2 actions are good at activating the Bulbospongiosus. The third muscle is the Puborectalis. The Puborectalis muscle runs from your pubic bone, it slings around the rectum and the urethra, and it goes back up to the pubis. That muscle, when activated, is going to compress the urethra or pull in the urethra from the backside. So to activate that one, we want to do a gentle anal squeeze. Now, we don't want to hold back gas as hard as you can because then you're going to add in those bigger muscles that we don't want. So just think about a gentle anal squeeze. So when you're trying to do the Kegel or the pelvic floor muscle contraction, we're going to be thinking about pinching off urine. We're going to retract or shorten the penis. We're going to pull up the testicles, and we're going to do a gentle anal contraction. Now that we know where the location of the muscles are, let's talk about how to strengthen them. So if you can get yourself into a comfortable position, preferably sideline, I would like you to first try and relax that belly muscle and relax the buttock muscles. Now think about that region we just spoke of, that bottom side of your pelvis, and I want you to relax those muscles as well. Then I want you to think, imagine stopping your urine flow. Hold on to that contraction. Now I want you to shorten your penis, retract, hold that contraction. Now add in the testicles, bring them up into the pelvis, hold. And now that muscle, remember, that wraps around the urethra from the back side, pull in that anus just a little bit. You're going to hold all three of those muscles, and I want you to count out loud to 10. If you're holding your breath, you're doing very little, if anything, for your pelvic floor. So if I simply ask you to count out loud, I know you're breathing. Then we're going to relax everything for 10 counts, and we're going to repeat that 10 times. After those 10 repetitions, then you immediately want to go into the fast twitch contraction. So I want you to think again. Hold off urine, pinch it off. I want you to retract the penis as you're pulling in. I want you to pull up the testicles into the pelvis. And now gentle anal squeeze. Count out loud to 2. 1, 2, and then you're going to relax. Relax everything for a count of 4. The relaxation phase is as important as the contraction phase because when you're relaxing, those muscles are recharging for the next contraction. So make sure you don't skip that part. I want you to do 10 of those fast twitch contractions as well. After you do both sets of contractions, and those are starting to get easy, you're starting to locate the pelvic floor, you can feel some of the pelvic floor moving, then I want you to start increasing the repetitions, which is how many times you're doing the exercise in that set. So instead of doing 10 of them, let's try to do 11 or 12. If you can feel the 11th or 12th contraction, keep it going. Then work up to maybe 14 and then 16. Your goal is to get to 20. So we want to have 20 10-second holds, 20 2-second holds. Once you get those 20 repetitions, and it seems pretty easy, like you can locate, you feel that contraction, then I want you to challenge the muscles a little bit. So now we're going to go to sitting. So sitting challenges those muscles a little bit more. So you're going to have gravity against the muscle, but the seat that you're sitting in will actually give the pelvic floor some support. So it's not quite as hard as standing. But I want you to think again, really isolate the muscle. Think about pinching off the urine, retract the penis, pull up the testicles, gentle squeeze of the anus. Do your 10-second holds, do your 2-second holds, 10 or 20 of each. At least get that up to 20 before then you challenge the muscles again. We want to then work into standing. In standing, the muscles are going to work very hard. They're going to work hard because gravity is pulling down against them and you don't have any support. So they should be in a relaxed state at one of their greatest lengths. So when you contract here, again, think of those locations. I'm going to say it again. Squeeze the urethra, pinch off that urine, retract the penis, pull up the testicles, gentle anal squeeze. Hold that for 10. Do that 10 times. You're going to repeat. Hold for 2. Relax for 4. Do that 10 times. Work that up to 20. The exercises are going to take about 3 months to hypertrophy or thicken those muscles, so stay consistent. Consistency is everything. If you can get these in 4 times a day for 3 months, those muscles will thicken. If you're an active person, recent research is showing that we can even wean off these exercises and the function will remain. Now, while you're sitting there, I want you to try just something. I want you to clear your throat or cough. And I want you to feel what happens into your pelvic floor. Okay, now I want you to add in that pelvic floor. Hold that steady. Now cough again. What did you see? What did you feel? Hopefully what you felt is during that cough, the pelvic floor kind of bulged when you didn't have anything activated. But when you activate the pelvic floor and you cough, especially when it gets a little bit stronger, you're going to feel that actually rise. And think about that rise and how it's supporting that bladder. So that's a technique that you can do or practice. So staying active and getting those muscles strong is super helpful. Now also, if you can walk prior to surgery and then when you can walk after surgery, that also stimulates the pelvic floor. So those muscles will continue to be contracted. It also helps with weight loss. So again, I just am going to encourage you to do the exercises before and after surgery when they allow you. Don't try these contractions when the catheter is placed. It does need to be removed before you begin. And then if you stay consistent, I can almost promise you this is going to pay off. Thanks for listening. I hope this video was helpful and you'll have a great day.